Well, today we have Tiffany Musick with us. She's a senior public health specialist at Missouri Department of Health and Senior Services. Her primary role is coordinating the Community Health Worker Program for the state of Missouri. Tiffany has helped grow the Community Health Worker Program, tripling the number of curriculum providers statewide, adding training, and helping the Community Health Worker Association of Missouri grow and become an independent, thriving organization. Tiffany, thanks for being with us today.
All right, thanks so much. Like was mentioned, my name is Tiffany Musick. I am with Missouri Department of Health and Senior Services. And while I do help some with the diabetes and cardiovascular disease programs, my primary responsibility is coordinating the statewide efforts for community health workers. We're going to talk about several different things today in our time together. As you can see on screen, we'll cover all aspects of community health workers, or as you may hear me refer to them as CHWs. We'll start with the definition of community health worker, their roles and responsibilities, CHW training in Missouri, the CHW Association of Missouri, credentialing for CHWs, and we'll end with several examples of how Missouri CHWs are making a difference. First, we're going to take a look at definitions for the position of community health worker. The Missouri Department of Health and Senior Services has chosen to adopt the American Public Health Association's definition of community health workers, or CHWs. This definition says that CHWs are frontline public health workers who are trusted members of and/or have close understanding of the communities they serve. This trusting relationship enables the CHWs to serve as a liaison between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. A CHW also builds individual and community capacity by increasing health knowledge and self-sufficiency through a range of activities such as outreach, community education, informal counseling, social support, and advocacy. The CDC has a very similar definition that states that community health workers are liaisons with resources in the communities they serve. Community health workers play a vital role in improving Missourians' health by providing a connection between health systems and community resources, as well as education on how to reduce some behavioral risk factors. The term community health worker is an umbrella term and includes community health representatives, promotores, peer support specialists, and other workforce members who are frontline public health professionals that share life experiences, trust, compassion, cultural, and value alignments with the communities where they live and serve. As you can see on screen, I've listed a few of the many titles that fall under the community health worker umbrella, such as patient navigator, community health representative, public health aide, lay health advisor, and these are just a few of the over 60 different titles that community health workers work under. We're going to take just a moment, if it loads, there it goes, to watch a video that was created by the Kansas City CHW Coalition and the Mid-America Regional Council in Kansas City, so that you can hear from community health workers and those that work directly with community health workers, just to kind of hear about what they do and the impact they make.
Our health is influenced by many things.
Okay, we're going to try one more time, and if it doesn't go, we'll just move on.
Our health is influenced by many things, like healthy food, secure housing, or access to healthcare. Those without adequate housing or employment, or who struggle financially, often have worse health outcomes. Community health workers provide critical support to those in underserved communities.
Community health workers are a key part of the healthcare system or the healthcare team. They work with members at the one-to-one level, and what they do is support them by assessing and addressing their social economic needs.
One of the taglines for community health workers is they are of and from the communities they serve. And that is so important.
Community healthcare workers are those frontline, boots on the ground folks who get in with the community and the people that they work.
Somebody who puts their heart and to put their passion just to make sure that others are getting what they need.
Community health workers are trained health professionals who help connect residents in underserved communities to resources. By helping clients obtain resources such as utility and rent assistance, healthy food, medications, transportation to medical appointments, their health status is often improved. Community health workers bridge language and cultural barriers to help clients communicate with care teams and follow through with their care plans.
Most of the time, community health workers have something very special, which is that they understand they have been in the community they serve. So they're able to relate with those that they're working with. What we have been advocating for is to bring that one-to-one level of care, to bring that connection between individuals and that trust that has been lost for many years.
And our goal is to really bridge those gaps where families are encountering barriers to accessing health services. So our community health worker spends a lot of time listening to the family first to understand what they need. And then from there, they begin to build, I think, a level of trust that allows them to help that family.
They are the ambassadors of health. You know, they just have a good understanding of the medical system, the social system, and also the clients in the community. So that's what, to me, a community health worker is.
Most community health workers are lay people in the community. We just are connectors. It's always good to have a peer, someone who's been there, who knows you, your community, your language, so to speak, whether it's literal language or, figuratively, where we're from.
Both Kansas and Missouri have established CHW certification programs, and in the Kansas City area, more than 20 organizations work with CHWs to improve the lives of their clients. CHWs work across the whole system, from hospital emergency departments to community organizations that provide social supports.
Do you want all families of all children to be able to access healthcare services in a timely manner and in a way that prevents problems from happening? And if you can answer yes to that, then you really want more community health workers.
There is a lot of evidence, research, and at the local level and at a national level, at a global level, that the role of community health workers is very important. They can have great impact on health outcomes because they are taking care of those socioeconomic factors or addressing those socioeconomic factors that clinical providers or the clinical team are not able to address on a clinical setting.
Community health workers can often get to some of the root causes of our illnesses that are, beyond the surface. Because we build those trusted relationships, we can find out a little bit more about what's going on at home.
When a client is struggling with their needs, sometimes they are overwhelmed. They feel like they fell through the cracks through the system and no one is helping. So when a community health worker is working with clients, they just get together in the client's house, right? So you are safe, you're in your own spot, you're in your own place. And it is that relatability that makes the client feel comfortable and they open up.
Community health workers are very much naturally, culturally competent. They are culturally humble. And they use those skills to advocate and protect the individuals that they work with. And also, I think it brings a lot of value for the provider. They are actually making sure that what the provider is saying, either in the same language or in another language, is being understood. So when the client or the patient leaves that office, the community health worker, the patient, and the physician are in the same page that is understood what is expected from the member.
At the end of the day, it's not just the CSW who has to do all this. The CSW is the person that can open or lead the client to the door but the client is the one that needs to open that door and just making sure that they follow through with the plan and everything. So
Community health workers are in the right place at the right time in clients' homes and neighborhoods to help people self-manage their health conditions and improve their health outcomes. CHW's work complements and supports the work of physicians, nurses, and social workers.
The favorite part of my job is just connecting with people. Love to see the aha moments. Love to see, people's like, I did it. I'm doing this. Yes, you did, and yes, you can.
we are just making sure that all the clients are becoming more self-sufficient. So that is going to help now and in the future, because if you train people on how to do those things on their own, that's magic. That is going to make sure that people is not struggling in the future. We might struggle with resources, but they will know how to get there when the resources are there.
It's an emerging role, and it's an exciting time to be talking about it, because I think it may be new to you, but it will undoubtedly become a familiar term, I think, over the next 5 to 10 years for a lot of people. I hope so. If it was up to me, we would be inserting them everywhere, in schools, in clinics, in churches, not just in emergency rooms and acute care settings, but we really need our community health workers everywhere we are. So,
Community health workers bridge gaps in our healthcare systems, providing better health outcomes for our family, friends, and neighbors.
One of the things that I think we're very slowly shifting is to the understanding that we have been paying for to fix things that are already broken. And we have done very little as a healthcare system to work in prevention and management. So if we know that and we can intervene early on time, we will be saving millions of dollars to the healthcare system. And we can do that by investing on a workforce that can do a lot of that work. And we are not there yet, but I think we will be there soon. Yeah.
All right, now that we have defined community health workers and have a better understanding of that, let's discuss social determinants or social drivers of health and how they relate to the CHW roles and responsibilities. It is important to understand what social determinants of health are so that we can understand why community health workers are so valuable. According to Healthy People 2030, social determinants of health, or SDOH, are the conditions in the environment where people are born, live, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. It's important to ensure that patients' social determinants of health are met first, because if they are not, the rest of what the medical or social services team suggest will not matter. Social determinants of health can be grouped into 5 domains as shown on screen: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Social determinants of health can have a major impact on people's lives, well-being, health, and quality of life. Social determinants of health also contribute to wide health disparities and inequities. For example, people who don't have access to grocery stores with healthy food are going to be much less likely to have good nutrition. That then raises their risk of health conditions like heart disease, diabetes, and obesity, and even lowers life expectancy relative to people who do have access to healthy food. This short clip from Healthy People 2030 explains the importance of focusing on social determinants of health.
At HHS, we define the social determinants of health as the conditions and the environments where people are born, live, learn, work, play, worship, and age. Social determinants affect our health, well-being, and contribute to health disparities and inequities as well. Healthy People, our nation's longest-running disease prevention and health promotion initiative, emphasizes addressing the social determinants of health to create environments that promote health and well-being for all. I'm Admiral Rachel Levine, Assistant Secretary for Health at the United States Department of Health and Human Services. Healthy People 2030 provides a framework for thinking about the social determinants of health across 5 domains. Here are the 5 social determinants of health. First, economic stability. People with steady employment are less likely to live in poverty and more likely to be healthy. By helping people earn steady incomes, we can achieve economic stability for all. Second, education access and quality. People with higher levels of education are more likely to be healthier and live longer. By helping students excel in school, we can improve educational access and quality. Third, healthcare access and quality. Many people in the United States are unable to get the healthcare services that they need. Increasing access to high-quality healthcare services will ensure more individuals can attain their full potential for health and well-being. Fourth, neighborhood and built environment. Health and safety risks, like high rates of violence and unsafe air or water, impact health and quality of life. By creating safe communities, we can provide opportunities to promote playing and physical activity. And fifth, social and community context. Increasing relationships and interactions with family, friends, neighbors, and community members is beneficial to an individual's health and well-being. To learn more and see how others are working to address the social determinants of health across the nation, please visit healthypeople.gov.
All right, now that we have a better understanding of how the roles of a community health worker is defined and what social determinants of health are and how they could affect someone's overall health, let's take a closer look at the specific role of a community health worker. Community health workers truly have a wide variety of duties. They recognize gaps and advocate for individuals and community health needs. They assist in coordinating care by linking people to appropriate information and services. CHWs also provide culturally appropriate health education to individuals, organizations, and sometimes communities in an effort to reduce modifiable risk factors and encourage healthy behaviors. They also serve as a culturally informed liaison between individuals and community healthcare systems. Perhaps most importantly, they provide encouragement and social support to assist individuals with goal setting and barrier identification within their professional boundaries. CHWs assist clients in their homes, community, or clinical settings. They communicate to their clients the purpose of the program and the impact it may have on their well-being. They help patients identify socioeconomic issues that affect their overall health and develop health and social management plans and goals. CHWs coach their patients in effective management of their chronic health conditions and self-care. They assist their patients in understanding care plans and instructions. CHWs educate their clients on the proper use of the emergency room and provide information for alternative care sites. They motivate their patients to be active and engaged participants in their own health and overall well-being. CHWs also document all client encounters. They complete and submit reports as required by their employer, maintain comprehensive electronic client files, including client notes, release of information, assessments, and other medical documentation acquired on behalf of the client. CHWs facilitate communication and coordinate services between providers and the patient. They coordinate and monitor services, including tracking of clients' compliance in relation to care plan objectives. They also provide support and advocacy during initial medical visits or when necessary to assure clients' medical needs and referrals required are being conveyed. They also follow up with both clients and providers regarding health and social service plans. CHWs do not always work in the health field. As I mentioned earlier in the presentation, CHW is an umbrella role, and many different roles. CHW type positions fall under that umbrella. The community health worker workforce is on the rise nationally. Many different types of agencies have discovered that community health workers are often the key to reaching people who are often left out in traditional healthcare and services. Community health workers are employed in many different types of organizations. They work in hospitals, medical clinic, outpatient care centers, schools, religious organizations, nonprofits, and even pharmacy. In Missouri, some of our partners have developed a few unique programs for CHWs. To date, there are over 100 pharmacy technicians in the state of Missouri that have been formally trained as CHWs. We'll discuss that particular training program later, but it's important to note that this training is for pharmacy staff created by pharmacy staff. Missouri also has several doulas that are cross-trained as CHWs. These cross-training opportunities provide the client with even better care. The reality is that CHWs anywhere have a similar role to link people with health and social services to improve the quality of care, but they work in many settings. They work wherever they live, including rural areas, urban areas, and major metropolitan hubs. Missouri has developed a comprehensive training for CHWs based around the CHW core competencies. Missouri CHWs are trained and expected to meet and understand the core competencies listed on screen. These core competencies guide the training CHWs complete in both Missouri and Kansas, but let's talk a little bit about what they mean. Professionalism and conduct includes how to handle ethical challenges facing the individual and communities served, individual confidentiality and privacy rights, balancing care for patients with self-care, how to act decisively in complex situations, but also taking full advantage of professional collaboration and supervisor support. And finally, the importance of observing organizational rules and applicable laws and regulations governing public and private resources while exercising creativity and helping community members meet their individual and family needs. Self-awareness seems pretty self-explanatory. However, it is really important. CHWs need to understand the importance of being aware of one's own emotional and behavioral responses to individuals and community members and manage personal feelings productively in order to maintain effectiveness as a CHW. Coordination of care and system navigation for individuals and families means that CHWs assist licensed healthcare providers in the coordination of care, help people understand and use the services of health providers and other service organizations, help address practical problems that may interfere with the ability to follow the provider's instructions and advice, helping to bridge cultural, linguistic knowledge and literacy differences, and understanding and sharing information about available resources and support to improve health services. Education for healthy behavior change simply means providing people with information, tools, and encouragement to help them improve their health and stay healthy over time, while also respecting people's experience and their ability to learn, take advantage of resources, and set priorities for changing their own behavior. Advocacy is working with or on behalf of people to exercise their rights and gain access to resources. It also involves supporting individuals and the community by bringing awareness to issues impacting health. Individual and community capacity building goes hand in hand with advocacy. It is encouraging individuals to identify and prioritize their personal, family, and community needs. It's encouraging individuals to identify and use available resources to meet those needs and goals, and providing information and support for people to advocate for themselves over time and to participate in the provisions of improved services. It's also building and maintaining networks and collaborating with appropriate community partners in capacity building efforts. Effective communication strategies include listening carefully and communicating respectfully in ways that are meaningful to the individual. It's a mix of listening, speaking, gathering and sharing information, resolving conflict, and checking for understanding. CHWs are also meant to be cultural mediators by improving services and reducing disparities. Identity may be based on race, ethnicity, language, religion, sex, gender identity, sexual orientation, disability, health condition, education, income, place, profession, history, or other factors. Culture also includes organizational cultures, which are reflected in how organizations deliver services. The CHWs encourage and help enable individuals to participate in decisions that affect their lives, families, and communities, sorry. Documentation and reporting is very important in the role of a CHW, and we spoke about that earlier, so I'm going to not define that further. Public health and community health is an evidence-based discipline that focuses on protecting and promoting population health, preventing illness and injury, eliminating health inequalities, and working to improve the health of vulnerable communities and populations. CHWs understand that individual health is shaped by family, community, and the wider social determinants of health. Individual assessment is an ongoing process that, when combined with regular evaluation of progress, helps assure effective individual and community-centered care. Individual assessment is the gathering of information from direct communication with individuals to understand, identify, and address the individual's goals for optimal health. CHWs facilitate health improvement planning with individuals and consult with the healthcare team to agree upon a plan as appropriate. And then finally, community assessment is to identify barriers and resources within a community. Community assessment is necessary for advocacy and capacity building to occur. The textbook on screen is what is currently used in both Missouri and Kansas for the CHW course. At this time, we actually have 3 different curriculums, all based on this textbook. The first curriculum that was created was a chapter by chapter traditional approach to teaching. After some feedback from curriculum providers on the students who had taken the course, they found that a lot of things were repeated several times or might be grouped better together. So a core competency-based approach to the text was created. And then most recently, a pharmacy-specific version of this curriculum was created for pharmacy technicians being trained as community health workers. This version follows that same core competency approach, but has specific examples related to the pharmacy setting for those individuals. These 3 versions of the state-approved curriculum are the only recognized curriculum for CHWs in the state of Missouri. While it is not required for CHWs to take this course, and they are certainly welcome to take courses from other organizations, they will not be eligible for CHW credentialing if they don't take the one with the state-approved curriculum. And we'll talk more about credentialing in just a second. We have developed at the Missouri Department of Health and Senior Services have developed a training program certification that we oversee. At present, the Bureau of Cancer and Chronic Disease Control maintains all aspects of the training program certification. This program has allowed the CHW curriculum to be accessible to as many CHWs as possible and help support the growth of the CHW workforce in Missouri. The department accepts applications from potential curriculum providers from May 1st through June 30th of each year. And then during the month of July, a committee of 3 people review the application. That committee is made up of myself, 1 other person from the department, and 1 board member of the CHW Association of Missouri. Each application is scored based on a rubric. Once all applications have been reviewed, a letter is sent to the applicant informing them if their application is approved or denied. We typically get those letters out by August 1st. If the application is approved, the letter includes information about where to access the curriculum and resources, along with the links to the pre- and post-course surveys. If an application is denied, the exact reason for the denial, along with suggestions for improvement, are given, and the applicant is encouraged to apply for the next year. Before teaching the CHW certificate course at any certified curriculum provider, all instructors must complete the Train the Trainer course. Whether the instructor has been teaching college classes for 30 years or has no teaching experience at all, they are required to complete the Train the Trainer course through DHSS or the Mid-America Regional Council. We offer this course at DHSS 2 to 3 times a year, depending on interest and need statewide. This course consists of 3 synchronous virtual trainings, which are held via WebEx. And then there are also 5 asynchronous pre-recorded trainings that are assigned throughout the course. And then finally, each participant must create a 30-minute lesson that they will present to the course instructor and a group of their peers. This whole course goes over adult learning theory, popular education, different adult learning strategies, and really focuses in on the CHW curriculum that they will be teaching. This map is a bit outdated. This is what it looked like prior to August 1st. We had 15 curriculum providers. We now actually have 16. We've had one drop off and 2 more come on. As you can see from the stars, they're pretty spread out throughout the state. We now have a curriculum provider in the Northwest kind of lime green color at the top left of the map, in central, let's see, North Central College, Missouri College, I think is what it's called. And then Mid-America Regional Council has also come in as a curriculum provider. We do have 2 curriculum providers in Kansas, both trained CHWs in both Missouri and Kansas. We have the Community Health Council of Wyandotte County and Kansas City, Kansas. And then we have Wichita State University Community Engagement Institute, and they partner with the Kansas CHW Coalition. Most of their classes are online. The other organization not shown on the map is CE Impact. This course is the one I spoke about that is exclusively online and is intended only for those that are current pharmacy technicians training as community health workers. And then we have Metropolitan Community College in Kansas City, State Fair Community College in Sedalia. State Fair offers their class 100% online, so people from anywhere in the state can take the class. We have Central Christian College of the Bible in Moberly, Mineral Area Community College in Potosi, Southeast Missouri State University in Cape Girardeau, St. Louis Community College in St. Louis, Three Rivers Community College in Poplar Bluff, Ozark Technical College in Springfield. And then we also have Diabetes Education and Augmenting Lifestyle Center and Clinic in St. Louis, and Real Justice Network in Kansas City, and the Doula Foundation of Mid-America in Springfield. DHSS also hosts a statewide advisory meeting quarterly. During this meeting, we seek out input from CHWs, their employers and instructors, other interested parties. We also have an opportunity for each region to share resources, updates, and best practices. These meetings have been very powerful for CHWs and often have over 100 people in attendance. At this time, the St. Louis, Kansas City, Northeast, Southeast, and Southwest regions have regular meetings where they have an opportunity to network and share local resources. DHSS has been working with the Southeast region to get them up and going, to help them develop collaborative regional meetings, and we will be doing the same for the Central and Northwest in the near future. All right, so I did speak a little bit about credentialing for CHW, so I just wanted to run through that real quick. In order to become a credentialed CHW or CHW-C, and individual must have a minimum of a high school diploma or equivalent. They must also have completed a CHW certificate program at one of the approved curriculum providers that we previously discussed. And each year, DHSS sends the Missouri Credentialing Board an updated list of approved curriculum providers after we review the applications. The application is pretty straightforward to become a community health worker credentialed, just as the Missouri Credentialing Board also supports the peer support specialists. Just like peer support specialists, the information is on their website, which is www.missouricb.com. They have to, as I said, they have to provide documentation showing that they've completed high school or the high school equivalency and the CHW certificate course at a certified curriculum provider. In addition to that, they have to complete the application and sign the code of ethics. They must also agree to a background check and complete the family care safety registry registration form, and then send all of this in with a $75 application fee. Once this is processed, the CHW is then credentialed for around 2 years. Once a CHW is credentialed, they are required to complete 20 hours of continuing education every 2 years. 6 of those hours have to be ethics, Each community health worker is expected to keep track of their own CEUs. They keep their certificates, and when it is time to re-credential, the community health worker is required to send in proof of their ethics course being completed. If they are audited, they also have to show proof of the other 14 hours of training. If they're not audited, they have to complete a form attesting that they have completed those trainings. Missouri Credentialing Board can audit at any time, so it's pretty important that the community health workers maintain proof of their training hours. Community Health Worker Code of Ethics includes information regarding responsibility in the delivery of care, promotion of equitable relationships, interactions with other service providers, and professional rights and responsibilities. The Community Health Worker Code of Ethics is based on and supported by the core values adopted by the American Association of Community Health Workers. This Code of Ethics outlines in the document. The Code of Ethics outlined in the document found on the Missouri Credentialing Board website that is shown on screen provides a framework for community health workers, supervisors, and employers of community health workers to discuss ethical issues facing the profession. Employers are encouraged to consider this code when they create community health worker programs. The responsibility of all community health workers is to strive for excellence by providing quality care and the most accurate information available to individuals, families, and communities. The Code of Ethics is based upon commonly understood principles that apply to all professionals within the health and social services fields, such as promotion of social justice, positive health, and dignity. The code, however, does not address all ethical issues facing community health workers, and the absence of a rule does not imply that there is no ethical obligation present. As professionals, community health workers are encouraged to reflect on the ethical obligations that they have to the community that they serve and to share these reflections with others. The Community Health Worker Code of Ethics has 4 articles, each containing ethical obligations. Article 1, responsibility in the delivery of care, addresses honesty, confidentiality, scope of ability and training, quality of care, referral to appropriate services, and legal obligations. Article 2, promotion of equitable relationships, addresses cultural humility, maintaining the trust of the community, respect for human rights, anti-discrimination, client relationships, intimate client relationships, and former client relationships. Article 3, interactions with other service providers, addresses cooperation, conduct, self-promotion, and cooperation with the Missouri Credentialing Board. And then finally, Article 4, professional rights and responsibilities, addresses continuing education, advocacy for change in law and policy, enhancing community capacity, wellness and safety, loyalty to the profession, and then advocacy to the profession and recognition of others. The Community Health Worker Association of Missouri, or SHWAM, is a collective of people throughout the state of Missouri working to improve health outcomes for a diverse population. The association brings members from across the state together to share ideas, raise awareness, and support each other in the journey towards public health. The membership of SHWAM has nearly tripled in size in the last year. The mission of SHWAM is to unite CHW instructors, employers, payers, and other stakeholders for professional development and community outreach to serve the communities in which they are involved. The Community Health Worker Association had their annual conference in March. It was a great success. They had a great turnout with excellent speakers and over 250 participants in attendance. The next conference will be March 4th through 6th at Lodge of Four Seasons. If you're interested in speaking at the 2024 conference, please let me know and I can connect you with the association. SHWAM's mission and vision is put into action through advocacy, educational opportunities, professional development, community health worker, community resources, and employment resources, and networking opportunities. Just wanted to, these are the board members. We have Suzanne Smith, Sierra Walker, Hannah Oberg, Florence Adagoki, Ryan Smith, Melissa Smith, Kathy Mason, Lorna Miles, Amy Summers, Yvette Chambers, Treva Smith, and Atara Smith. The last two on the screen, both Treva and Atara, are also members and board members for the National Association of Community Health Workers. So it is pretty great that Missouri has 2 representatives on the NACHWA board. I'm going to skip this next slide for now because I really want to talk to you about how community health workers are making a difference in the lives of their clients' lives, in the day-to-day lives of their clients. Day in and day out, I hear so many stories about how community health workers have changed the entire trajectory of someone's life. And I wanted to share a few of those. In recent conversation with one of the administrators from the Columbia Boone County Health Department, this person stated that CHW's working in the community is shedding new light on what the health department does and needs to do. And the administrator went on to say that CHWs have breathed new life into the agency and stated, "We really are helping people." The Southeast region of the state has also had a great deal of success incorporating community health workers in a variety of settings. One agency in that part of the state was able to help a 74-year-old woman find housing in a nursing home. She was previously homeless. The CHW has continued to follow up with her to help coordinate her care because she has several chronic illnesses. The CHWs in that agency as of April had also found housing for 5 additional people since December, and they are continuing to work with those people to address health needs and social determinants of health. CHWs have also been working in a school-based dental clinic in an elementary school in the southeast part of the state. The dental clinic recently found a tumor in the roof of a student's mouth. Because of the early detection, the student was able to have surgery and remove the tumor and is now doing great. The CHW continues to follow up with that student and their family about other social determinants of health. Another CHW in the Southeast region helped a homeless veteran suffering from PTSD find housing and get connected with the necessary medical providers. Because of this assistance the CHWs provided in his time of need, this veteran now wants to give back and help others in his situation, is in the process of actually signing up for a CHW class himself. The St. Louis region also has some really great things happening. They have CHWs working inside jails with incarcerated individuals that are getting ready to be released from jail. The CHWs help their clients connect to resources so that they are set up for success upon the release from jail. Missouri also has fantastic things happening in pharmacies. Missouri has the only curriculum designed to train current pharmacy technicians as community health workers. If you think about it, pharmacy technicians often have more contact with patients than their doctors or the pharmacists. Patients with chronic illness typically see the pharmacy technician each month for refills and may see the doctor every few months for a checkup. Unless it's a new medication, they don't always speak to the pharmacist. The pharmacy technicians are able to develop a relationship with the patient, making it more likely that the patient will feel comfortable discussing other social determinants of health. The pharmacy technician is then able to connect the patient to resources, ensuring that all needs are met. There's a pharmacist in Southeast Missouri that tells about a patient that he encountered several years ago, and it is one of the best examples of the benefits of having a community health worker on your care team. The local doctor had diagnosed and been treating an older woman for diabetes. Months go by and the patient is on insulin daily, but her A1C is simply not coming down. With permission, the doctor talks to the pharmacist. Is the client picking up her medicine? Yes, she is. Okay. So then he asks the client, are you taking the medication? She says, yes, absolutely. Are you taking it as prescribed? Yes, sir, I am. The doctor and the pharmacist put their heads together and determined that there is no way this woman's A1C would continue to rise if she was taking her insulin properly. The doctor then asked the client if it was okay if a community health worker just came to visit her at home and to see, where her insulin is stored and kind of check the levels and that kind of thing. The patient says, of course. The community health worker then goes for a home visit on a bright, beautiful fall day. After visiting a bit and going through the standard questions, she asks the patient, can you show me where you store your insulin? The patient agrees and shows her that it is in the refrigerator, just as the doctor and pharmacist have instructed her. But if you'll recall, I said it was a bright, beautiful fall day. Prior to looking in the refrigerator, the community health worker had noticed that the lights were not on, but had not thought much about it because the curtains and windows were open. As it turned out, there was no electricity in this home. The patient had been following the doctor's instructions verbatim, but not one person had asked if the refrigerator was working properly, or if she had electricity in her home. The patient hadn't mentioned it because no one had asked. The community health worker was then able to connect this patient with utility assistance to get her electricity and water turned back on and make a plan to ensure that it stayed on moving forward. Months went by and the patient now was able to keep her diabetes under control, and her medication is properly stored in a working refrigerator. Before I wrap up, I would like to watch this one last short clip together. This video shows Magdalena's story and how a community health worker changed her life. Magdalena is a patient at Lorna Linda University Health's Diabetes Treatment Center. She was depressed and immobile, having difficulty navigating the complex health system, but a community health worker was able to step in and help. As we watch this video, I want you to think about what would have happened to Magdalena if she hadn't had a community health worker available to offer the support that was needed.
A community health worker is really the bridge between the healthcare system and the community. They're the eyes and ears of the healthcare system, looking at what the environment's like that we're sending patients back into.
Community health workers can spend more time with their patients, but more importantly, they come from the community. So they understand because they themselves have a similar shared lived experience, or they've had to overcome and build their own resiliency.
We've always lacked that ability to kind of go outside of these walls. We can't see what the patients are up against in their actual setting at home. So community health workers are able to leave the clinical setting and kind of go out into the community and bridge that gap.
Mi corazón está al 30% y traigo marcapasos. Loma Linda me mandó a las clases de diabetes y yo fui y ya la enfermera me dijo que llenara la aplicación. Yo le dije que no sabía y le hablaron a Alejandra y ella vino a ayudarme a los papeles. Sí, porque yo no puedo el inglés, ni sé escribir, ni leer, ni nada, entonces ella me ayudó en todo.
I explained to her part of my work, but I don't like to be like, this is what I do, boom, boom, boom. So it's more like a friendly conversation. So I told her, like, I can do home visits if you want. We can just talk. And if something that I can help you with, I'm more than happy to do it. But this is going to be like together, like hand to hand.
Sí, ahora hay un cambio mejor de mente y de cuerpo. Ahora ya puedo caminar más. De mente me siento mejor, porque antes tenía como sentía mi muerte y pues sentía como mucho depresión. Y ahora ya siento que estoy mejor. Y antes tenía que andar aquí en mi casa con bastón. Y ahora camino sin bastón y ya camino, voy a las tiendas y todo. Y hago ya más actividades que antes.
The way that she's been empowering herself, she's been growing a lot. And little by little, she's been able to advocate for herself.
Para mí es importante ella porque ella me ve como ser humano. Ella es importante para mí porque es mi compañía, me ayuda con la cita, los papeles, me ayuda con medicinas y a veces convivimos un poquito así y así. Es muy importante para mí ella.
Because the community health worker is not clinical, they are very much community focused. They can tap into a lot of those resources that we just don't have access to. We give them a plan here, and then she is able to see in the home setting what their barriers are.
Healthcare for decades has been trying to solve community issues from a healthcare perspective, but we'll never be able to really accomplish that unless we are engaging that community as partners in the process. Alejandra has been just a wonderful example of what a true community health worker does and is. It starts with a heart. They have to have a heart for service.
That's what I'm here. That is, I wanted to be with them in the same boat. No outside, with them, inside, in the same boat with them. It's the best way that you can see the missing parts of the puzzle. So this kind of work that we're doing, we're gonna be able to touch more in depth on the patient, not just as a patient, but as a human,
All right, I know I've been talking for quite a while. My contact information is on screen. Please feel free to reach out to me. I'm happy to connect you with community health workers in your area, the CHW Association of Missouri, resources, or really anything else. With that said, does anyone have any questions? All right, well, thank you so much for your time and letting me share. And again, please feel free to reach out if you have any questions or I can help you with anything at all. Have a great day.
Thank you.